Thank you for meeting me. Can you say your name and talk about what you do for work?
So name is Eddie Ramirez. That's Eddie Ramirez.
What inspires you about the work that you do?
So the inspiration to become a dentist started all when I was 8 years old. So this was on my last visitation to Mexico, where my aunt had just graduated dental school. And I was bored at my grandma's house, and so my aunt just said, hey, come work with me. So I ended up becoming her unofficial dental assistant for the day. My responsibilities included cleaning the spittoon, which is the spit bowl that nobody uses anymore. Went ahead, came back, and I told my mom I wanted to be a dentist. And it kept being in my head until high school, when I went ahead and then applied for the charter program called the Center for Advanced Learning, known as CAL, in East County, and I did their dental health science program. Was able to graduate with my high school diploma and as an assistant, and then continued on to undergrad and worked as an assistant, but always knew I wanted to be a dentist. And finished my undergraduate studies, and then fulfilled my wish of getting into dental school, and here I am, as an official dentist.
What does your typical workday look like?
Working day to day it's a variety of different things. I can be doing a lot of surgery, looking at a lot of extractions. I could just be doing some normal fillings, or even restoring the entire smile of a patient. Being that I work in the public health sector with Virginia Garcia, our patient dynamic is very different. In a normal private sector, you see individuals who are coming in and they're picky about a little chip. They're picky about, wanting to just have a white smile. With the patients I serve every day, unfortunately, they have a lot of self-confidence issues, but that's not because of them. They have unique backgrounds. They might have just arrived here in the country. They're here on asylee status. They might have just arrived from their country because they were at risk of being persecuted back home. And so here, we have to do a lot of what we call disease control. And it's removing all the decay to really bring them back to oral health. Sometimes bringing it back to health does mean, bringing in that missing tooth with maybe a partial, or maybe even, transitioning over to a full denture. And as they slowly start going through their appointments, they're able to not only improve their oral health, but they start smiling more and start seeing, this big old black spot that I had in my front tooth is no longer there. And as we grow and grow and grow, they start getting more definitive care where, they're able to, have what we'd consider a Colgate smile, people really need that nowadays when job interviewing, when seeking, different employment opportunities, and just being out in the world. Of course, now with masks, we have to hide it for good reason, but in a normal non-COVID realm, what's the first thing somebody sees? It's your smile, it's your appearance, it's your overall facial expressions.
How would you describe your place in the community?
It's really interesting because I came up from this community. So when I was in elementary school, after I came back from Mexico, it became evident that I wasn't a normal, typical student. I remember vividly returning from school and seeing both of my parents. And both of my parents were home, which was really rare because mom works regular shift and then dad worked graveyard. So when one was at home, the other was at work. So it's very interesting to see them both present. And I asked my mom, I was like, why are you both home? Turned out they had both been laid off from their job. At that point in time, I just said, well, we'll be fine. We'll be fine. You'll find some other position and we'll keep moving forward. I mean, I was 8, 9. This was when I got back from Mexico, that last trip. And I went to school the next day, where I asked my classmate whose parents also worked with mine. I said, hey, my parents lost their jobs yesterday. Did yours? And she just responded and said, your parents lost their jobs because they're illegals. At that point in time, I was, took everything with a grain of salt, went back home, and I told my mom, hey mom, so-and-so said that you lost your jobs because you're illegals. At that point in time, I didn't know what that meant, but my mom started tearing up, and I just said, we'll be fine, mom. We'll be fine, mom. But I didn't realize that I too was in those shoes. And the effect of it didn't really spark until my high school times. when at age 16, everybody's talking about getting their driver's license. Everybody's talking about going to college. And for me, I wasn't able to get a driver's license. I didn't even know if I was going to be able to go to college. At that point in time, it was 2008, 2009, and then I graduated in 2010, where the post-secondary education system had no knowledge on what it meant for a student that's undocumented. They didn't know whether they could accept you. They didn't know whether they can take you into their school. They didn't know if, you were allowed a spot in their program. It was the same thing in dental school, where I became the first undocumented student to be accepted, matriculated, and now graduating and practicing in the state of Oregon. So going back to the initial question of how does it feel working with this community? I faced what they're facing now. Whether it's not having documents, I still face that currently because I'm on DACA status, Deferred Action for Childhood Arrivals, where my future's on limbo. I don't know if my program will be permanent. I don't know if my program will be rescinded. It's already been rescinded multiple times. So I'm always in limbo. And that's how I connect to my community, because I know there's a story behind what I'm treating today. I sometimes, take a tooth out, do a filling, but there's more to that individual than just that cavity, more than just that tooth that needs to be extracted.
What are some challenges you faced along the way?
Being undocumented it's rough. It's really hard in the sense that you're denied opportunities just because of a lack of a social security number, a lack of a document that just says United States of America. And they really tell you don't belong just for that simple fact. In the college education system, and even in the dental school application process, it's hard because I had to be that advocate for myself. When I asked for assistance from a pre-dental advisor, from a counselor, they actually discouraged applying to dental school. And I think oftentimes we're told no, and we let that no become an official answer, and we stop pursuing what we want. For me, I had to go ahead and, not have that mentality. I had to keep pursuing my dream. I had to not let those no's stop me. When an individual said I wasn't going to be able to make it into dental school, I became my own advocate. I started contacting dental schools and talking about my situations, and I applied to 5 dental schools. Out of those 5, 3 rejected me without even looking at my application because they saw that I had DACA. They didn't want to investigate or see how this could be an opportunity for me. And, it was in simple rejection. And I was able to be the first to be accepted to OHSU School of Dentistry here in Portland. And interestingly enough, funding was the biggest thing. Dental school is expensive. And I was working at Portland State in the admissions department, and it got to the point that I needed to figure out whether or not I was going to go ahead and afford dental school. I remember the day clearly was April 21st of 2014. I had been accepted that December of 2013, and it came time to decide whether I was going to be able to afford dental school or not. With my immigration status, I applied to many loans, was denied. I did not qualify for financial aid. I still don't qualify for financial aid. And I made the hard decision of withdrawing my spot from dental school. I was giving up my dream to be a dentist, but out of my control. But I was comfortable knowing that I made it as far as I did. I remember walking in that morning and telling my supervisor what I was going to do. And I asked her if she could read over my email. And she said she would. And I drafted it. And then she said, don't send it. So I worked the entire day, and I was ready to send it that afternoon when I had a voicemail from the Dean of Admissions at OHSU saying that I had been awarded a full ride scholarship to OHSU School of Dentistry. It was thanks to a state legislator that, passed what's known as the Scholars for a Healthy Oregon that really emphasizes on bringing students from underrepresented backgrounds and underserved communities and pushing them through the medical profession. And it's because of that I was able to achieve my dream. Now, as much as this sounds successful, I mentor students all the time who are in my same shoes, and they talk to me about how they're struggling to get the finances. And it breaks my heart because I don't have the money to give them and tell them just, have a easy, just focus on dental school. But the reality is, it's hard. I made it through dental school, but I was also working 20 to 30 hours, sometimes 40 hours a week, which is hard when you're in dental school, when you're going to school 8 to 5. And we have to remember that even though my tuition was covered, I still had other expenses. I still had other fees that I was responsible for. And I had to push myself and get that income. Was it a challenge? Yes. Was it worth it? It most definitely was. The biggest thing is I had to keep myself motivated, and having my family, having my close friends, they were the constant reminder of just keep pushing and moving forward.
What are some things that you wish people knew about the work that you do?
I hope that the communities have a realization that I'm not just their provider. I came from the community that they are in. I know their struggles, and to just realize that if I can make it, they can too. They don't always have to be, struggling to find employment, struggling for funds. We all have the capacity to realize our dreams, become successful, no matter what our background is, no matter what our immigration status is, no matter where we come from. We all have the capacity to be successful. Sometimes it's just finding someone who can push them. And I hope that I might become that person that pushes them to success and not just be their dentist that they see every 6 months.
Do you have any advice for students who are trying to find their way?
Part of college, part of the end of high school is exploring what you want to do. It's okay to say, I want to be a dentist. And then you start exploring and you're like, no, this isn't what I want to do. You have to get out into the field, whatever it may be, job shadow, find somebody that has that job and see if you like it, if you see yourself doing that. Don't wait until you've graduated, finish that degree, get out into the workforce to realize you don't like it. Right now is your opportunity to explore, to test things out, to, see what you like and what you don't like. In school specifically, what subjects are you passionate about? What subjects do you not like? And use that as a push to figure out what you want to do. And it's okay in the high school age, and even in early college, to say, I don't know what I want to be, but just keep exploring until you find that passion.
What advice do you have for students who might want to do similar work in their own communities?
When you're a student, you have to just have that end goal in mind. Surround yourself by individuals who are going to push you, who know what your aspirations are, who are individuals that when you fall down, they're going to pick you back up, who are going to be there to support you, who are going to be there to motivate you, who are just going to be there when you most need them. Constructing that support system is key. And looking at your instructors, looking at those people around you, and sharing your story. For me in high school, I was scared about coming out as undocumented. When I did, I had instructors who offered to pay for my tuition. And I had multiple instructors who I was blessed to, send checks to the university. And that's how I was able to cover part of my tuition during my time at Portland State. You never know what putting your story out there, what constructing the support system might do for you.
What's next for you?
I'm still figuring out what I want to be when I grow up. I think you get a career and then you're like, what can I do next? What can I do next? Whether it's expanding into a sole practice, which is growing within the public health sector, or going into the private sector. There's so many options with dentistry, more than you can imagine. There's a business side, there's a public health side. You can move your way up to becoming director of an organization. All I know is I have a passion for serving. Who will I be serving specifically? That's to be determined in the next couple of years.